presentations. So hello and welcome to the Platform Uptake second virtual matchmaking event. My name is Alexander Nikolov and I'm working for Senior GmbH based in Vienna, and we are coordinating the PlatformUptake.eu project. Today, together with our partners from AAL Austria, we seek to give providers of open platforms in the active and healthy aging and assisted living domains, developers of technology for active and healthy aging, care organizations, researchers, and decision makers the opportunity to present and discuss their offerings and needs, benefit from the knowledge exchange, and establish collaboration and partnerships with their counterparts. All presenting solutions, platforms, and requirements for technology for active and healthy aging will be actively promoted through our project newsletter, communication, and dissemination channels. The event will start with a short presentation of PlatformUptake.eu project, its current achievements, and planned future actions. The session will be continued with a presentation done by our kind partners from AAL Austria on the goal, benefits, and collaboration opportunities offered by the network. After this introductory part, we will dive into the world of innovation for active and healthy aging and digital technology for care and healthcare. Today, we have really interesting presentations covering the whole spectrum of research, development, and innovation in the field. The aim of this matchmaking event is to also make the participants and the audience think about openness in terms of interoperability, common standards, compliance with various regulations on national and European levels. Because in the end, as you know, all presenters are dealing with solutions or project or platforms for active and healthy aging or assisted living domains, and our contribution is to bring them together and to put some focus on the important benefits, usefulness of being open. At the end of each presentation, but also at the end of the event, you'll have the opportunity to ask questions to the presenters. The event will end with a few words from our colleague and friend Frederick, who represents Leven Slackman, based in Belgium, which is also a consortium organization in the PlatformUptake.eu project. Please feel free to ask us questions anytime in the chat option in the right below corner, or interrupt us during the presentations. We'll be more than happy to answer them either during the event or after its completion. All right, so let's move on with a short presentation on Platform Uptake. I would like to tell you a couple of words about the background of our great project. So as you know, aging presents one of the greatest socioeconomic challenges of our century. As such, the EU has invested vast amount of resources for the development of ICT-based solutions, including open platforms for the development or creation of an open market for digital technology for active and healthy aging. Unfortunately, their impact in the field and existing gaps haven't been thoroughly analyzed and assessed. Some of them are unknown to the wider public in Europe or have even stopped existing. Against this background, PlatformUptake.eu seeks to understand the whole ecosystem of open platforms in the active and healthy and assisted living domain, and contribute to the development of open market for digital solutions and ultimately promote the uptake of these platforms. PlatformUptake.eu project is a coordination and support action from the European Union's Horizon 2020 Research and Innovation Program with a duration of 29 months. So what has our project achieved so far to achieve this goal, namely the uptake of these platforms? We have created an open information hub, which features information on existing open platforms and digital solutions for active and healthy aging. The hub represents also the main reference point for all project stakeholders when it comes to knowledge collection and knowledge exchange on pressing issues and challenges in the field. Based on the defined KPIs for the monitoring and assessment of interoperability, synergies, and cost-benefit analysis of the open platforms in the field, we have created tools that allow for both platform providers and developers of technology for all people to evaluate and compare the current state of the art and establish cooperation with their counterparts. Further, PlatformUptake.eu project designed and developed a massive online open course that is aimed towards healthcare and care providers as well as policymakers, and seeks to help them build understanding of the use of open platforms in the field and their benefits, and support them in the choice of a platform that can be integrated in their organizations. To bring the importance of open platforms, but also highlight their benefits for the developers of technologies in the field, our project conducts ongoing interviews with experts in the active and healthy aging domain as well as matchmaking activities to allow for interested organizations benefit from the knowledge exchange and explore future collaborations. Within these matchmaking activities, PlatformUptake.eu project seeks to promote best practices and reach stakeholders not involved with the services of the existing open platforms. The interested parties have the opportunity to register on our hub, submit a pitch, and engage with the platforms identified by the project. All right, so that being said, I would like to pass the floor to our co-organizer and colleague, Mr. Uli Weidel, who is the director of AAL Austria. Uli, the floor is yours.
Thank you, Alexander. Can I share my own presentation?
Of course.
Thank you. It's easier then. Good. Okay. Great. Thank you, and a warm welcome from my side. I'm Secretary General from Active and Assisted Living Austria, innovation platform for smart assistants in everyday life. And actually, I would like to give you an introduction of what our platform is doing, but before I would like to draw your attention to the fact that active and assisted living is looking at health and care from a very broad perspective. It's about prolonging the life of people in their own home environment, so in a good quality of life. And it's basically not about adding years to life, it's about adding life to years, as a clever man said. And there are a number of areas we look into that. Basically, the human being itself is in the focus in its home environment, and of course health and care. What we usually understand under health and care is a top area, but there are also issues like safety and security at home, which can lead to incidents, etc., supporting people at home in the activities of daily life. And social participation is a very, very strong issue we need to look at when it comes to quality of life. So just to give you a few keywords, what we understand, so do you see the broad scope of this active and assisted living area. In health and care, we mainly look at physical mobility of elderlies, mental activities, dealing with chronic conditions, and so on. So we look at lifestyle issues, exercise, nutrition, or in chronic conditions, monitoring vital parameters. Adherence to medication is an issue, and of course, prevention is a big issue to make people healthy or let them stay healthy as long as possible, and support care at home. Rehabilitation, of course, once there is an issue, illness, surgery, and so on, people need to get well again in their homes. That's what we basically talk about. And safety and security is another big point. Hazard prevention is an issue there. You would like to prevent falls, water damage, getting lost or locked out, and so on and so on. And in the event of real danger, then of course the rescue chain needs to be set in motion. So just to give you a short idea on what we understand under safety and security. Activity of daily life speak for itself. I think it's about personal hygiene, dressing, cooking, eating, drinking, and so on, shopping, banking, to support people to do this from their homes as long as possible, or support them in their environment when they go out. And functions you find in smart homes can also ease life of elderly people. So last point, social participation, as I already said, is crucial for quality of life. Isolation is a big issue in aging. So we look for connectedness to family, friends, neighbors, access to events in all kinds of areas, and access to media, so that elderly people also can access media in a good way. So that's it, basically, to span the scope of what we do from a topic side here at Active and Assisted Living Austria. Who are we? We are what we call an innovation platform that was initiated by the Austrian Federal Ministry of Climate, Energy, and a lot of other things, among innovation and technology. That's where we are located from the origin. And our goals are to establish and extend the Austrian active and assisted living community, to improve the topic, the visibility of the topic, and there's a solution in there. That's why we have events like this today, and bringing together stakeholders from different sectors. That's basically what we do, and also what we do today here with all of you from all over Europe. We celebrate our 10 years anniversary this year as a non-profit organization with more than 110 organizations from broad sectors. We have the biggest one here. It's not translated into English. It's more than 40% are companies that develop and produce solutions and technology for this field, 20% about from research, science, development, and at the moment about 13-15% from social service providers. The board, the organization is led by a board of 12 directors, supported by a secretary service office that we lead. Now, what do we do in a nutshell? We are a basic contact point for active and assisted living topics in Austria. We foster efficient exchange of information and experiences, so mainly through our website, our newsletter, event calendar that we lead on related events. And we organize and participate in events to share experiences. That's what we do also for fostering the networking and cooperation among the Austrian active and assisted living community. We have a number of activities here. We have some working groups working on, for example, ethical aspects in these projects. We promote guidelines for ethical aspects, for example. And we have built up a database that covers Austrian active and assisted living projects with the related players, which can be found also on our website. I don't think I put it here, but the website is AAL.at. So a number of things. We do workshops, and we have, in Austria, we have about 10 pilot regions, roughly, where active and assisted living technology is being piloted. And here we look into the information exchange between these pilot regions. You can all find them on our platform. Unfortunately, there is only a limited part in English so far, so be aware most of it is in German, unfortunately. And last but not least, we try to improve the image and visibility of active and assisted living, the topic itself. We lead an annual conference where we share experience between all stakeholders. This year it will be on 16th of November in Graz for the 5th time already. We also promote active and assisted living success stories, where we cover successful implementations of AAL solutions in real life environments. You can find them, as I already said, in German on our website. And we represent the active and assisted living community towards ministries, public consultations, and events, and so on. So if you like to support us, feel free to contact us. Give me a call. You find all the contact information on activeandassistedliving.at. And thank you, and I wish you good luck for your forthcoming presentations.
Thank you very much, Uri. I will share again back
yes.
our presentation. All right, so we can move forward with our interesting pitch presentations. And before we do so, please, guys, try to keep up to the 5 minutes. So we're kind of on time at the very end of the event. All right, so our first pitch presenter is Mr. Kai Gans from the Technical University in Dresden, Germany. Kai, are you there?
Can you hear me now?
Yes, we can hear you.
Sorry, there was an issue with the microphone. So, yeah, so then good morning also from my side. Greetings from Dresden and East Germany. So next slide, please. Yeah, there's some part missing here. Shall I switch better to my?
Please feel free to share your updated version.
Yeah, then sorry, then I will do so.
No problem.
Yeah, sorry for the mess. So, yeah, once again, thank you for the chance to presenting here. So, what I'm going to present is Project VCare. What we are doing in the project is in a multidisciplinary and international or Europe-wide project field supporting elderly patients' rehabilitation with an evidence-based technology, namely a virtual coaching solution that complements the regular care of the patients by this virtual coaching solution. We have, as you can very briefly or very roughly see in this map, partners from all over Europe with both clinical, technical, and strong exploitation competencies and capabilities, so that we have a strong consortium in this regard. What's the basic problem and the basic issue we are tackling? That after quite well supported rehabilitation in clinical settings, and often it is the case that from the beginning, from the transition to the home, the care approach is quite limited and there are often disruptions in the care chain. Maybe you have a visit of a nurse one time a week or something like this, but not that regular as before. And so our idea is to re-establish in the end the continuity of care by introducing technology, a combination of several technical means with this virtual coach that is just briefly represented here in the middle as a real rendered human-like coach that supports the patient in their home rehabilitation, provides reminders for doing exercises, provides even the exercise itself, provides an overview of their health status in the end, allowing to keep the continuity of care as set. To do so, we have several technical components as set, several sensors like for heart rate, like for the step count. So somehow something like a smartphone, a smart watch, sorry, in the end, to support the professional caregiver in observing the clinical state or the well-being state of the patient, and to have a context integration mechanism for our technical solution that is also based on machine learning features, so to complement the absent caregiver. All is based on the clinical knowledge of the clinical professionals. By grasping this knowledge in terms of clinical pathways, so in terms of the procedural steps the patient should take, that is all modeled in distinct tool and a distinct description language, so that can be automatically grasped by the virtual coach and to control the home rehabilitation. So this is also part of our experience, what could be shared, namely the experiences with a small scale design evaluate stage over several months with about 80 patients for 4 different pathologies with this technology and the joint work of the clinical and technical partners. In the end, what we need in the upcoming months as a project is going to end already in August. For continuation of the idea, of the core idea of the project, of course, further funding, a financial investor, for example, would be needed, and also further technology partners to further mature the rehabilitation coach solution. Also, we would be interested to attract early adopters, for example, hospitals or other healthcare organizations, that could further advance a clinical study, even coming to a larger randomized control study to, even more underpin the advantages of the solution, and of course searching for synergies with the field of hospitalization at home to the greater extent. So the 5 minutes are mostly over, so just a brief look where you can find more information on our part, namely on our social media channel, our YouTube channel, Twitter account, and of course also the website. And of course, feel free to contact us in case of any questions. Thank you.
Thank you very much, Kai. I just have one quick question regarding testing of your digital rehabilitation advisor. Have you experienced any challenges concerning technology acceptance from the side of the older people and ETS? What was your approach to tackle this challenge?
Yeah, of course, we have this kind of issue. I would say the approach was that we have the 3 testing stages. So from a very technical testing stage to a home testing that we are now in, and there we, let's say, increase the level where the users get involved in the technology and try by this way grasping their feedback and improving the solution. But of course, with elderly people, it's always a bit hard to get engaged with technology. And in this case, it's also a little bit harder as we have neurological pathologies here in case where they have also some impairment. So it's not so easy, but we are just in this final testing phase, convincing them to really use it. But of course, it's an issue or challenge.
Thank you very much, Kai, for the really nice, interesting presentation. So we move forward with our agenda. The next presenting organization is Kineticus Health. I will share the presentation from my side again. All right, Claudia, feel free to start when you're ready.
Okay, can you hear me?
Yes.
Okay, great. Good morning, everyone. And I would like to thank you for the opportunity to be here and to present and introduce Kineticus Health. Can you pass to the next slide? So we are a digital health company specializing in translating human movement into clinical insight. And I will explain in detail a little bit more about us in the next slide. But before I would like, sorry. But before I would like to say also that we have experience in innovation projects. We are actually currently coordinating an Horizon 2020 project, the ProCare for Life project, and it has been very enriching experience. At the end of this year, at the end of 2021, we have seen also approved a Pathfinder project in Horizon Europe, and it will start in June. And in the last 2-3 years, we had other individual projects funded by the European Space Agency and structural funds. Now, yes, you can pass to the next slide, and I will explain a little bit. I will come back to what we do and explain our solution. So we basically turn a smartphone, a device that practically all of us use, including older adults, into a medical grade platform to assess mobility in an accurate manner and to monitor treatment. By using a smartphone, the citizens will passively collect information, objective information from their daily activities, and this information will be sent to the health professionals, allowing them to evaluate the disease progression, for instance. Our app has also other features that help personalize healthcare, such as the patient-rated outcomes, events diary, personalized exercise, a communication channel, news feed, and others. In the next slide, in this slide, I present also the way the healthcare professionals see the information. So the information is collected through the app, will be available to them through our intuitive cloud-based platform. Still, this platform also allows not only collecting seeing information from that is collected from the app, but also collect and processing in-clinic measurements. And this combination turns it into an excellent tool to support clinical decision making. So, in the next slide, please. Yeah, summarizing our expertise and based, of course, on what we do. Our cloud-based solutions provide the secure and reliable data in compliance with EU and US data protections and security. Our solution is a medical device class 1, and we are about to conclude class 2A. We are in the second phase of the auditing process. And we have recently started our FDA approval process. So we know in detail the challenge of a regulatory pathway, and we can bring that experience. Our solutions are scientifically validated. We have been using it for Parkinson's disease, but they can also be used in different ways. They can be used in clinical trials to reconstruct and classify human movement, relying on the state-of-the-art of biomechanical models and machine learning algorithms. We can use it also to analyze the movement of athletes, providing relevant clinical information for treatment and recovery time. It can be used as to assess the risk of falls, as we talk already, as being a problem. Our app is also reviewed by the ORCA system, exceeding the required 65% of quality threshold. And you can find our app on the App Store, on the Google Play. And the next slide is just to finish. Yeah, to finish, I would like to say that we are available to collaborate with everyone that thinks that human movement analysis can be relevant for you. And you have here my contacts. Please reach us, and if you think we can be of any help.
Thank you very much, Claudia, for your really interesting presentation. I think, as you mentioned, your experience with regulations across Europe on European level is really valuable, because as we all know, that's really a challenge for a small company to expand in a cross-border manner. Thank you very much, Claudia. So let's move. Thank you. So let's move with the next presentation, which will be done by Mr. Raul Benis from Corsano. Raul, would you like me to share your presentation?
Sure. Good morning, everyone. My name is Raul Benis. I have a Spanish name, but we're based in the Netherlands. I'm Dutch, and I'm going to tell you a little bit about Corsano Health and the product we sell. It's the cardio watch, which you see also on the image, as we believe it's a nice tool to support active and assisted living solutions. Next slide, please. So what we do at Corsano is we develop, we design, we produce, and we market a wearable. And in our case, this is a bracelet. And this bracelet is used to measure in a non-invasive and continuous way remotely a big number of vital parameters. So we started in 2014, and in 2015 we incorporated a company based in Switzerland, and that's where the modules are made. So you can say it's a Swiss-made watch. It's a medical grade product, so we CE certified, but more important is that it's also clinically validated. The first validations we started in 2017, and they're still ongoing. So Corsano Health started in 2019 in the Netherlands, and from here we do sales and marketing. We have our CE certification for the cardio watch in since 2020, November 21, and we're selling our first products out to companies like Philips, Medical, Charité, so the University Hospital in Berlin. We won recently a big call for the Dutch Heart Association, where we're going to build a new application for unwitnessed cardiac arrest, where alarm service will be notified in an automatic way by the cardio watch in the case of a cardiac arrest. Next slide, please. So, like I said, it's a bracelet we provide. It's called the cardio watch. We also provide a software solution, meaning a web portal to get access to the data. The bracelet itself, it's called the cardio watch, but we don't offer a screen because we believe we don't need a screen. We don't want to show the vitals. We just want to measure the vitals. So what we measure is heart rate variability, breathing rate, all the activity parameters, all the sleep parameters, and we give you access to the raw data. And we're one of the few companies giving access to the raw data. On the second version of the cardio watch, which will be certified in Q3 this year, we will also have ECG, SpO2, GSR, which stands for galvanic skin response, and it's an early indicator for stress levels. Core body temperature, so not ambient or skin temperature, but core body temperature, and blood pressure. Next slide, please. So the way it works is you wear the wearable on the wrist. It's connected via Bluetooth to a smartphone, and on this smartphone there's an app running, and the main purpose of this app is to transfer the data to the cloud, which will be accessible for someone who is authorized and have an overview of the data. We also provide APIs and SDKs. Next slide. So to summarize, what's important, it's a wearable, but it's CE certified and all the parameters are clinically validated. We give access to the raw data, and we have a high data frequency up to 128 hertz, sorry. Battery life up to 2 weeks, and the design of the product is done in such a way that the sensor location is always good, and it stimulates continuous wear. So the product needs to be worn during day and night. The cost of the product is 200 euros for the first version and 250 for the second version. Next slide. So applications are, there are many applications. So not only for hospital use, but also for home care, research settings, and integration in platforms. And especially here, where I see a goal for us to participate in this meeting. So anyone who would like to get in contact to us, with us for integration, please let me know. Next slide. So what we do at Corsano itself, we produce the hardware, which is done in Geneva. We develop firmware, smartphone applications for iOS and Android. We build the web portal ourselves, APIs, SDK, and we have data scientists working for us to help us with the clinical validation and also with the algorithm development. Next slide. Well, that's it all from my side. Please feel free to contact me for any questions. I'm happy to help.
Thank you, Rio, for the really nice presentations. I caught one thing that you mentioned 2 times, access to raw data. I'm just curious, do you expect something for providing this raw data, like a fee or something like this? How do you regulate this exchange of raw data?
Well, I mean, for example, if it's we give access to the raw data only for authorized people. So, for example, if you're doing a clinical study and you use our web portal to get access to the data, you're able to download the data over there.
All right. Thank you very much, Rio, for a really nice presentation. We move forward with the next presentation, which will be done by Mr. Martin Wirke from Better at Home. Martin, please feel free to take over. Hi, Martin.
Okay, I will show my own presentation. Just a sec.
Perfect.
Okay, you can see now, right?
Yes.
Okay, perfect. My name is Martin Wirke. I'm project manager at Be Home from Berlin, Germany. And we are actually the first all-in-one provider of innovation solution for age-friendly living with technical assistance systems. And our idea is to combine digital technology with local service providers. So basically, it consists of 2 parts. On the right side, a modern home emergency call system. There you can see some of the components. And on the other side of a digital Be Home platform, our own platform that combines local service providers that we connect with the customer. And by doing so, we create new and sustainable business and care models. Okay, next page. And how we do this? We are like a central service provider, a central platform. And on the left side, on the supply side, we combine hardware, software, and services. Hardware, for instance, a tablet and some sensoric and stuff. Software includes intelligent escalation software, as well as our Be Home platform. And services are services like online consultation with doctors or grocery delivery services, or also professional care services and stuff. And on the right side, there is the demanding side. We are always looking for partners in the field of real estate companies or health insurance, local authorities, and professional care providers. That helps us to provide the all-in-one solution for the customer. And so they also help us in terms of co-financing and distribution. So what we are actually looking for, on the button you can see our current network. And we are always looking for partners and customers, as I mentioned, especially real estate industry, communities, or welfare organizations. We are always looking for strategic investors. And as we are manufacturer independent company, so we are always looking for new interesting hardware or software, especially in the field of IoT or ambient assisted living. And of course, we are always looking for local partners to realize certain projects. Okay, I guess I'm through. That's my contact details and the contact details of our CEO, Professor Arno Elmer. So feel free if you have any questions.
Thank you, Martin. Thank you very much for the nice presentation. If there are no any questions now for Martin, please feel free to ask him these questions in the chat option or in the discussion round at the end of the event. I'll share back the presentation.
Thank you.
Cool. All right, and now we'll continue with the presentation done by Alejandro Cavaliere from Incasa. Incasa is a artificial intelligence-based platform. It's a really interesting product. Alejandro, feel free to
good morning, everyone, and thank you for letting me be here. Let me share my screen if you don't mind.
Of course.
Share because it kind of updated and not in red color. Hold on. So hopefully, can you see my screen now?
Yes.
Good. Thank you. Thank you again. So let me go to the next screen. So we are in Casa, based in Spain. We are incorporated in Spain in 2020. We are a company derived from a digital telecare project that we had in 2016. Now we are in a completely different project on the same active assisted living, active aging space. In Casa is a platform for a smart home for the elderly, smart home for senior people. That's the core of what we do is IoT. You will see in a second is artificial intelligence software, but the paradigm that we created, or at least we today we move ahead, is that the elderly to live safe at home need to have a smart home. So how we do that? As you may imagine, we do that with sensors, and we do that with a platform, and we do that with software. The company and the sensors, the hardware and the software are 100% European. We use technology from Italy, from NICE and Fibaro, Italy. The look and feel of one of the sensors, for instance, is like this. This is not a golf ball, some people think. This is a multi-sensor, temperature, movement, humidity, a number of things. With a few sensors, it's completely wireless. We use the C-Wave protocol for those who are interested in more technical things. But the most important thing is that we place a little box, a white box inside of the house. And this box contains a home care protocol that we coded in software. We coded in code. Okay, so here is code. Here is the intelligence of the house. And since we place the intelligence inside the home starts to be intelligent today, but next year, 2 years from now, 3 years from now, it gets more intelligent. We process everything inside the home. So with that flexibility, we have the ability to create an intelligent environment. To the right of this slide, you can see a little bit of the rules or the protocols that we developed for home care, things like activity by night, activity when there is no lights, emergency calls, emergency buttons, all kinds of things. People who need to recover at home, stay in bed, things about electrical risks, etc. We call that the ERAS protocol, E-R-A-S. E stands for emergency, R stands for risks, A is activity, and S is status. That's the software that runs into the home within Casa using all those sensors. Okay. Cooperation. So we are pre-revenue. We don't have customers yet. This is a project that started last year at the end of 2020 here in Spain. We are looking for partners. We are looking for communities interested in this project, both as potential customers, B2B, B2C, but also as a partner to move forward in the different countries, because this is going to be different country by country, even city by city. So we have many areas of cooperations. We can be the supplier of a smart home platform for you guys, for your companies, so we can complement with what you do. We can be the supplier of the smart home platform for anyone who needs it. Okay? Or we can accept partnerships that bring content to us, and we can build something stronger than what we have today. So that's what we call smart investing. We are looking for investors, but we are looking for partner investors, the kind of investor that is interested in AAL, interested in active aging, interested in this paradigm. What we provide is ready to roll, ready to go to market, smart home for the elderly. Okay. What else? I mean, on the areas of expertise, specialized expertise, we have found and we have developed some smart home specializations for people with blindness or people who are hearing impaired, that we can add to the platform as well. Those are specialized applications of in-casa. Okay. And also for home care, for at-home recovery, the hospital market. Here's my contact. As I say, we are in Spain. We are open to have conversations with any of you. I probably call some of you because I'm looking at the presentations and they are very, very interesting. So you probably get my email very soon to ask you for a one-on-one. Okay, thank you very much.
Thank you, Alejandro. Thank you very much for the really interesting presentation. As you mentioned, after the event, we will share the presentations with all participants and the contacts so you can exchange more information.
Thanks.
Share back the presentation. All right, so our next presenter is Mr. Bryce van Eekhout from Communicare. Bryce, please feel free to take over.
Thank you very much. If you don't mind, I'll just share my slides because I have some animations to share, so that will make things a little bit easier, I guess. Let me know if you can now see my slides.
Yes.
Yes, it's working. Okay, perfect. So thank you very much for inviting us. I want to present to you Communicare today. And let's start where we started. So in a nutshell, we started in Belgium with the experience from patients in oncology that were looking for more interaction, more personalization of care and participation in their own care. And also on the doctor's side, a need for a more convenient and continuous communication between them and their patients. So starting in oncology, the startup is a spin-off from the University of Liège, and we really focus on how to create this better communication between patients, their relatives, and the caregivers. So our area of expertise is into the development of software solutions. Today, we really focus first on chronic diseases. So we already have our platform being used in multiple types of cancers, heart failure, COPD, diabetes, and others. But we also have some examples of it being used into the discharge after hospital. So for example, patients leaving intensive care. The whole point is first to focus on empowerment of the patient, so how to provide them information that is personalized to their needs and gives them a safe environment of information with information that is dedicated to their needs. But also to help them to get in touch in a shared decision-making environment with their doctors. So being able to get their preferences, work on this, and give an output that can be the start of a discussion with the doctors. Secondly, we really work on supporting the follow-up of patients. So depending on their specific pathology and the needs of follow-up, we parameter that with the care team, and we develop predictive models in order to detect signs, for example, in COPD of exacerbation and risk of rehospitalization from home, to get that and to enable the patient to take action. Quick overview of our care companion. Of course, this is quite limited because those are just three of the major functionalities, but the whole idea is this personalized information, an environment in which they can then also do their follow-up with either connected devices at home or their own devices with manual input. But also a medication adherence follow-up, which is key. And in the first studies that we've had the chance to do, we could see that there is an improvement in the self management of the patient and their medication adherence, this perceived medical adherence. Now, on the caregiver side, we also have a dashboard which enables doctors to do the management of their patient, the administration on the platform, to follow up on the outcomes that are provided by patients, and those predictive models which will enable to create alerts that are specific to each patient. We also have modules for example, teleconsultation, which have been used quite a lot during the pandemic, as you can imagine. As a conclusion, today what we have is a CE certified app. So in this sense, we have quite a lot of experience in the certification processes. We are also involved in major European projects such as Horizon Europe projects and EMI projects. So we have experience in proposing, writing proposals with partners. And what we are looking for today are also clinical partners to go a step further. In Belgium, for example, there is a reimbursement scheme in which we're very well placed. The next level for us is to collect signs of efficacy in the sense of socio-economic benefits. So we're looking for more clinical partners to expand out of Europe. So that would be something we would be very interested in also to get in touch with you if it's something you're also looking for. So here is my information, my contact details, so don't hesitate to also get in touch with us. Thank you very much.
Thank you, Bryce. Thank you very much for the really nice presentation. We move forward with our agenda. Our next presentation will be done by Marco Fociano from TerraForge platform. Marco, would you like to share your own presentation, or would you like me to move?
Okay, I think you can. Can you hear me?
Yes, I can hear you.
Okay, yeah, we can use those slides. Yeah. So we are, hello everyone. We are a startup. We just started this year, and we're working on some exciting technology. We're working on development tools. So what we are already selling on the market is a platform, or actually a platform builder called TerraForge. Let's go to the next slide and explain why it is, right? So we realized that it's important to provide very powerful tools to digital health innovators, because creating good digital health solutions is hard. Let's go to the next slide. And one challenge, for example, is privacy and security. So we're working very, very hard with our cloud-based platform to try to tackle these problems for the developers, so the developers don't have to worry about that. Next slide. In particular, the kind of technology that we have chosen is considered the holy grail of computer science. It's called rapid application development. It's basically tools that everyone can use. So they are, for example, very popular in universities for students or even medical students that are not even developers. They can use this solution without writing any line of code. It's called a no-code type of approach. Let's go to the next slide. So we're really trying to help anyone get into digital health because we feel very, very passionate about it. So we provide all the components like Lego blocks that you can assemble, whether you're a developer, like a senior developer, or whether you're a student and you maybe don't know much about development. And with these Lego blocks, you can assemble in a very short amount of time with limited costs, a solution, a digital health solution that works on your typical mobile device and connects to external devices like wearable devices. Next slide. And so why is that? Because we spoke to a lot of developers, and when the developers have two choices, the easy way, the so-called rapid application development way, or the traditional way, which requires writing everything from scratch, the vast majority of the developers say that they prefer the easy way. They prefer having these libraries available to them because they become more powerful, they can do more work, and eventually they produce better software. Next slide. So that's what TerraForge is. We call it a digital health laboratory, but it's basically a platform builder. It's not a platform, it's a platform builder. It's a technology that is available. You can look at it on GitHub. So it's open source. So you can get there, take a look at the software, take a look at the libraries, and see how that helps a lot, bringing down the complexity and building really nice digital health applications. Next slide. For example, you can build applications like these that are used either in academia or used by industries in various areas. For example, we are building a digital health application for Parkinson's disease with a partner. And even newbies, even non-developers can actually build these kind of solutions. Next slide. The other powerful capability is the cloud platform that we provide. That's similar to Dropbox. So you build your application and then you want to synchronize your data, your digital health information from one device to another device. For example, from a patient to a doctor, you can do that transparently and very easily. Next slide. Then you can collect digital health information directly from the mobile device. You can get it directly from the phone. You can directly get it from the smartwatch. And by the way, Terraforge is the first rapid application development platform for the Apple Watch, and also from external devices like wearable devices. Next slide. The other important part, obviously, is privacy. So we make sure that privacy is managed appropriately, making sure that the patient is in control of the data. Next slide. And for example, for the Parkinson application, we allow the patient to get access to a number of sensors that they already own, right? So if they have an Apple Watch, if they have a smartwatch, they already have a number of sensors. We want to make sure that the doctor and patients, of course, get access to the power of these sensors. Next slide. Once that information is collected from the mobile device, then it's important also to display, whether it's for the doctor or for the patient themselves, in a nice dashboard, all the information, including the compliance information, for example, if they're taking medications or if they're following a particular routine. Next slide. This kind of technology, and the components that we're using are already quite mature and used by major institutions. So this is a technology that can be easily brought up to the market, either to academia or to major industries, and anyone can get access to it. The key innovation that we're bringing is just to make it accessible to anyone, even to non-developers. Next slide. And that as a startup, so we just launched our solution. We're already getting noticed, and we're already getting a significant amount of traction, for example, in universities that are interested in creating projects, and in partners, like in case of our Parkinson application, that is going to be used as a digital therapeutic. Next slide. So that concludes my quick overview. If you want to get more information, we have some information in the presentation, but directly go to GitHub. We like open platforms. We are an open platform, and we like collaborating with others. So all the information is available there or on our website, hippocratestech.com. Any questions? Yeah, I think you can stop there at Q&A. The rest is just additional information in case there are questions. Thank you.
Thank you, Marco. Thank you really for your really nice presentation. If there are no questions for Marco, we move forward with our next presentation done by Ms. Sarah Tesla from Fondation Bruno Kessler. Sarah, would you like me to share your presentation?
Oh, no, it's okay if you share. Thank you very much.
All right, you're welcome.
Thanks. So good morning, everyone, and thank you first of all to the organizer for allowing us to present today. So let's jump right into the presentation, as 5 times are not that much. So Fondazione Bruno Kessler is a research center, a research institute that is based in the north of Italy. We are mainly related to science and humanities, and in particular our scientific hub is devoted to the application of AI technologies in different domains. Today I am representing the Center for Health and Well-being. So next slide, please. The assets, the 3 main assets that I'm presenting here today are Track, which is our personal health record, our virtual coach, and the work that we are doing on big data analytics. Next slide, please. So Track Yes, that one. So TREC is the personal health record that is currently used within the autonomous province of Trento, where FBK it is located. FBK is part of a competence center on digital health, together with the local healthcare trust and the autonomous province of Trento. So together we are developing different digital healthcare services that are used then by the healthcare trust and so by the patients or by the citizens directly. So TREC is this platform where we test different solutions. Here you can find some examples. So we have, for example, Salute+, which is a solution that is provided for free to citizens, that is related to the promotion of well-being. And then the other solutions, some of them were developed during COVID in order to provide a telemonitoring, a telemedicine solution to patients. To provide them with the possibility to communicate and to interact with their practitioners and also to some specific diseases, for example, ophthalmology or oncology. And TREC, as I said, can be used for, can be made available to third parties also to test their solutions. And that is, for example, the asset that we have provided in the proposal of the European Digital Innovation Hubs that is now to the second step at the European level. Next slide, please. The second asset that I'm presenting here today is our virtual coaching system that is based on a platform developed here in FBK, which is Horus AI. The virtual coach, we use it in different projects, as you can see here below. There are both local and European project, a 2020 project, for example. And the virtual coach aims at providing the support to citizens or patients for the self-management of well-being or chronic disease condition. In this respect, the platform is domain agnostic, meaning it can be applied to different contexts, to different diseases or to well-being in general. Of course, this requires co-design together with the end user, so both the patients, but also from clinicians where we are dealing with a particular disease. And the idea is to support the user in, for example, adhering with their care plan through a goal-based approach. Next slide, please. So finally, last but not least, this is the asset that is mainly related to AI technologies. By using big data, we are developing algorithms for both predictive medicine and personalized medicine that are able to classify, predict, recommend, ensure privacy and confidentiality. So the idea is very in line, in our opinion, with the strategy of the European Commission for using data in a sure, in a trusted way to provide additional services that can be used for our healthcare system. So the idea here is to support clinicians in terms of decision making, for example. So this is my presentation. In the next slide, you can find my details. And of course, you can just send me an email or ask me a question today. Thank you very much.
Thank you, Sarah, for the really nice presentation. Just a short question regarding Salute+. Is that a mobile application? What kind of solution is that?
Yes, it is an app that is currently available in Italian or from the Google Play Store or Android Store.
And is it also in several languages? Is it only in Italian or can be also
now it is in Italian.
Oh, okay.
Yeah.
Thank you, Sarah. Thank you very much. All right, so let's move with the next presentation, which will be carried out by Mr. Ralf Hartmann, because you know AG.
Yeah, can you hear me?
Yes.
Okay, thank you very much. Hello to everyone. Casenio was founded in 2014, and the idea behind was the base of ambient assisted living so that people could stay as long as possible in their homes, older people or people with handicap. Yes, thank you for the next slide. For that reason, we started with a sensor-based solution, as you know, from the ambient assisted living to prevent a dangerous situation and offer quick assistance. But when we started, after a very short time, we realized very soon that the user himself, they don't like technical assistance because they do not fall, they are not old, they don't leave the oven running and all this. So we have to start a new evolution. And we did this around about 2016 together with our customers. And now, as you see, we combine safety, security, social integration, and communication in one product. The base, what you see is the white small box. The base includes a gateway with different transmission protocols like Wi-Fi, Bluetooth, and Ocean, Z-Wave, and also OMS, for example. We can offer the most situation with this product, with this transmission protocols in a home. So the target that the people could stay as long as possible in their homes is realized. And we are also well prepared for the future. Additional to that, we offer smart building solutions. When you think at water or heat or air quality, something like this, when you think of Corona. And the most interesting aspect for the user are the reminders and the social integration. So we can use our product as an info board, for example. So the user get information when the elevator is not working, for various events in the area, special offers or other things. Up to video calls with the family, video calls with the concierge, for example, for the care companies, and also for doctors. As an open platform, for us, this is very, very important. We can also integrate third parties, smart metering solutions, door video solutions, or something like this, and also further developments. For me, it's also very interesting what my colleague from Corsano said, Mr. Bennis. This is, for example, one thing. This is could be very interesting for one of our customer, and I think I will get in contact with you after this meeting. Next slide, please. What we want to do is, for sure, we want to sell our products. We are looking for new partners, and we are also looking for new solutions, new sensors, new things that we can offer to the market. At the moment, we are very far in the market with our solution because we combine so many things. But the development in this area is so fast, so quick. This is for me the most interesting thing in this market, to make life in homes more comfortable and more safety. Next slide. Yeah, thanks for your attention. That was very short, very quick, a short overview. It's a very complex system, but I hope you get a very good first impression. And if you have any questions, feel free to contact us. Thank you.
Thank you very much for the really short, concise, and informative presentation. So let's move with our next presenter, Mr. Sergey Golanov from Golem, a company based in Vienna, Austria.
Hello, can you hear me?
Yes.
Okay. Greetings. First, thank you for colleagues from the senior for inviting for platform uptake participation. It's interesting project and unique opportunity to see all this development, about 30 presentations in one time frame. Is great. So regarding our platform, it's big into system. It's difficult to explain within 5 minutes. So let me just briefly outline what's going on. Please, next slide. Yeah. So we are a small company, about 20 people in Vienna, in Austria, developing the technology. We don't have significant expertise in medical sciences. So please, next. Okay. So our approach is different. I have not met Uli Weibel personally, but it's interesting to see that we have the same view of what should be the assisted living technology. And we are in complete, let's say, synchronization in this. What main issue we address? First, as a people, we don't have possibility to look continuously to dashboards, to monitors, to charts and tables. To see what is the blood pressure, what is the temperature, and so on. We don't have knowledge to understand what are the combinations of these indicators and how to interpret them of biomarkers. And we need actually assistance, continuous assistance during our life in monitoring, continuous monitoring of what's going on in our health, assistance in predicting things which may happen, advisory services. I have not run for the last 3 days, not significant actions. We need more activities and so on. So we need advisory service. And all this stuff requires actually someone, we call it virtual nurse or virtual personal doctor, which actually running in the cloud, continuously monitoring all our biometrics, biomarkers, all these things which can be measured, analyzing in real time, continuously collecting information, analyzing, calculating multiple indicators, analyzing homeostasis conditions, interpreting results using medical knowledge base, formulating conversations in complex dialogues, and interacting with people in natural languages using mobile phone and smart speakers. Please, next slide. So what we look for? We look for partners to apply to some projects which are, let's say, there is a new project which is called Horizon Europe, which is called Horizon AI and Human Interaction. So we look for partners to collaborate in this project, and we provide our technology, which actually is open source based. It's platform with tools to make rapid developments of so-called digital twins with complex cyber biophysical system model, link the model to different sensors, IoT devices, and we consider the modeling of the big system, which is called Smart Human Earth Smart Home. So the system actually collects data from the human biomarkers using various devices, including watches, weights at home, activities at home, and so on. Plus safety, security at home, doors open, closed, windows, and so on. Then each person has personal intimate digital twin which run in the cloud in Kubernetes clusters. with own personal database. This digital tool is supposed to run for the life. It's automatically analyze all the data and has environment of people who has access to personal data if the person allowed it. For example, I can allow my doctor to access my personal data and or medical assistant, and they can see a lot of biomarkers, and during the interactive sessions with me on a mobile phone, and analyze what's happening and have advice from the system that my health may have trends to this particular situation, on that particular situation, using the medical knowledge database. This is very brief introduction what we do. Actually, the system is based on the open source components only. We are in prototype phase. The system already speaks. We use open source platforms only. And for speaking, we use rasa.com with multiple languages, European languages. And we invite partners to collaborate in the incoming project in November. We look for coordinator and clinical partners, which can help to fill in the medical knowledge base for interpretation of multiple biomarkers, combinations, analyzing sustainability and optional outcomes. So this is very briefly the presentation. If it's possible to say within 5 minutes about big system. Please next. What's the next slide? Okay. So the idea is to have personal digital twin, which is conversational, helping us to live and predict what's taking place in our lives, what may happen. Because, you know, when we come to doctors, I'm sometimes very surprised to hear why you haven't come early. And it's interesting to, of course, to hear this, because why I should have come earlier if I haven't no information that I should do it. Please, next slide. Okay, so those who will be curious or interested in collaboration, you are very welcome to contact us. The overview of the system is in our website, Golem.at, Digital Twin for Ambient Assisted Living. The coordination, we look for coordinator who is experienced in Horizon Europe project. We can provide complete technical support for implementation of new ideas in medical sciences, and AI assistance in application of AI, machine learning, and other system science tools for delivering the practical solutions for this very complex area. Thank you.
Thank you very much, Sergey, for the really concise presentation. I know that 5 minutes are not enough for such a complex topic, but thank you very much. Like he mentioned, please feel free to visit the Golem website or also our hub, where we have a also short profile presentation of the Pharos Navigator platform. All right, so if you don't have any questions, we'll move forward with the next presentation done by Mr. Bogdan Ivanov from NutriCare Life, based in Romania. Bogdan, please feel free.
Thank you for the opportunity, Alexander. Please, can I share my presentation?
Of course.
So, I'm Bogdan from NutriCare. It's a digital platform which provide a lot of valuable information regarding nutrition. We are implementing precision and personalized nutrition through our digital platform. And the main outcome is the ultra personalized recommendations on food and supplements. We are providing the exact quantities of food and the exact quantities of supplement to be able to prevent diseases and so on. And on top of this, to increase the level of personalization, we are using a lot of at-home nutritional tests like genetics and microbiology and so on. And here it's an image of our platform. If you see here with the yellow line, is the nutrients, micronutrients intake based on our users' eating habit. They can insert their eating habit using a food frequency questionnaire, or they can have a predefined diet. They can choose a predefined diet, and we develop the yellow line. And we compare the actual eating habit with what our users should eat. And we compare with the blue line, which is European Food and Safety Authority dietary recommended value. And for those users who want to go to a deeper personalization of our food and supplements recommendations, we use a nutrigenetic profile, microbiome profile, and so on. And we develop the purple line. And here it's a very nice example. If you look at this user who have this eating habit, he need to increase a lot in vitamin D intake according to the European recommendation. And if this user have a nutrigenetic profile developed, he can realize he need more nutrients intake in vitamin D. So this is the platform, and we can provide the food recommendations, supplements, and so on. And finally, we can go to meal plans to provide them. We are looking for healthcare providers who can develop a project together with our solutions in nutrients deficiency assessment, and we are looking for partners who apply for European grants. And finally, of course, we need money to scale our business and to develop further our digital platform. Yes, you can have access to our digital platform. It's free for all, and everybody can find the nutrient deficiency when we compare our eating habit with European Food and Safety Authority. And for those who want more, we have a shop where we can provide at-home nutritional tests according to our portfolio of tests. Yeah. My name is Bogdan, and I'm waiting for connection to be able to develop our project together. Thank you, Alexander.
Thank you, Bogdan. Thank you very much for a very nice presentation. Are you also connected with some delivery services, since you're recommending particular nutrition intakes based on the biological profile or state of? Are you also offering some concrete, let's say, delivery services, etc., or?
So we are offering a complete service.
Platform recommends.
We are able to provide at-home nutritional testing. We are able to assess the nutrients deficiencies based on our digital markers developed in our platform, and we can increase the level with our at-home nutritional test. You can see here, if the video goes, we have several type of nutritional testing, and we can send it to our customers directly to their home. And finally, the final objective is to eat healthier. We can develop a meal plan for each user.
Thank you. Thank you very much for your nice answer. So I'll share back the joint presentation. All right, sorry, Webex kicked me out. So our next presenter is Nico Lankinger. Nico, please feel free to take over and present your services.
Okay, hello everyone from Finland. I have to apologize that I just noticed that I have a wrong template. So actually I could share my screen to you. So okay, hopefully you can see this presentation.
Yes.
First, briefly about the company. So we are quite a young company, about 6 years old. We have done several digital projects in different industries, not only in social welfare and healthcare industry. Our first own solution is a two-tier modifiable digital solution or mobile app called MyNavigo, and it consists of MyNavigo Guider, which has been piloted one of the biggest social and welfare districts in Finland, Päijät-Häme. So the basic idea is that everything can be found from the same digital pipeline or service channel based on a comprehensive self-assessment in different areas of well-being and health. So first you tell about how you are feeling, what are the actually risk factors in different areas of well-being and health, and based on that you are able to receive information that supports your health promotion, and also information of the preventive providers in different areas of well-being and health. So basically there can be several NGOs, private actors, public actors that are found from this same pipeline. So it's an open platform or a web page, and there's a link below. You can find our solution we have been implementing in the social and healthcare district of Päijät-Häme. And the second one is also based on functional capacity self-assessment. It's targeting for these preventive interventions or measures in a chosen target group. So basically, this is a survey that can be carried out for the pilot group that is in question. So this is just an example of MyNavigo Guider process. So this is totally modifiable. So the first actually phase is that you enter on a web page where you just click one button, and then you carry out this self-assessment in the chosen areas of well-being and health. Then you receive feedback, and if you are in the risk group, then you are able to receive this light service or coaching from the provider that is responsible for the specific area of well-being and health. So this is mainly remote support you are able to receive from this digital service channel. And another example of MyNavigo effect. So there's a personalized code that each target person receives, and then they just fill up the background information and carry out the self-assessment, and in the last phase they receive a real-time feedback. And a service provider, for example, public or private social and healthcare provider receives information what is kind of the actually effectiveness of these timely measures that have been carried out based on the data we have first gathered and what the situation was then and after these preventive measures have been carried out. So this is basically the MyNavigo Effect solution, and both have been piloted in Finland. And if you are interested, we are of course interested in finding partners, social and health providers internationally. This has been only piloted in Finland, so this is where we are going at the moment. Thank you.
Thank you, Nico, for the really nice, interesting presentation. We're having on the 13th of May a webinar with a healthcare cluster from Finland, so you're more than welcome also to join there. Maybe you see and hear some familiar companies.
Thank you. Very interesting.
All right, so I'll share back the presentation. Our next presenter is from Turkey, representing a healthcare organization. Erkan, please feel free to start.
Thank you, Alexander. Can I share my screen, because it will be much faster to keep the time?
Of course.
Because I have a long presentation, so I will be moving faster.
Please feel free to do so.
Do you need to leave the screen to me? Still, I see your screen.
I'll stop sharing so you can take over.
Yeah, please. Perfect. I guess you see my screen at the moment. Right? Okay.
Yes.
Thanks for giving this opportunity again to our foundation, which I am representing. It's situated in the capital city Ankara, named as BOSEV. The BOSEV is mostly dealing health and education related initiatives in the country. And we are dealing mostly any health related topics in our facilities spread all over the city. We have some medical centers. You see on the screen some of the samples from our medical centers dealing in various branches with our staff, which is over 1,000 in total nowadays, with the new hospitals joined to our network, with the new professionals arriving to our foundation to give contribution to the activities ongoing on behalf of the health-related services to the community. We have also a publishing company dealing with the publication, especially for the medical sector. Some articles arrived from the professionals. This is the last hospital dealing with the physical therapy and rehabilitation related services. This is the biggest facility, our hospital in the city, giving services in all kinds of branches inside this building. We are providing also some scholarships and also to the women community, disadvantaged groups, different kinds of educational activities. We are also representing a network with the protocol signed between the stakeholders in the city, including the different kinds of educational institutions, regional authorities, also a Chamber of Commerce, giving contribution to our activities, which mostly ongoing under Erasmus Plus related funding opportunities to spread all kinds of opportunities to the community. We are always getting contact. Also in the COVID related process, we provided different kinds of trainings to the related parties, professionals working close to the health and education related initiatives. We started with the below the knee disease, vascular surgery related topics to work with the European peers to give contribution to the contents necessary for the health sector. Also dealing with the elder people to give contribution to their life, to make their life much more comfortable. Dealing also in volunteer-based initiatives. This is one of our last projects, ended with the Spanish colleagues to give contribution to the brain-injured people and their relatives, to give contribution necessary training they may need in their ongoing life. Also dealing with the elder people to give contribution to their life, to get them more skilled with the digital health literacy, to reach to the necessary services provided by the government. Also dealing with volunteer-based initiatives, also working with the migrated population, also with the people in working in prisons, to give them the necessary training needs for their professional lives. Also dealing with the entrepreneurship related activities to give contribution to the community on behalf of our team, including my coordination. That's all for now. To get in contact, please use our social media channels to proceed with the next initiatives to be together in the upcoming initiatives. Thank you.
Thank you very much, Erkan, for a really informative presentation. And thank you very much for your concise way of going through the slides. Please feel free to contact Erkan after the event. All right, so let's move forward with our next presentation done by Francesco Buriani. Francesco, are you there? If Francesco is not present, we'll jump straight forward to the next.
Should be here, is connecting.
Oh, okay, thank you. So let's just wait a few minutes, if you can join us. Oh, there he is. Hello, Francesco.
Thank you very much.
Welcome.
Good morning, everyone. I'm going to tell you in a few slides, maybe less than 5 minutes, what is our offer. I work for a hospital whose name is Fondazione Casa Sollievo della Sofferenza in the southern part of Italy. Next slide, please. Thank you. We are a not-for-profit healthcare institution, and we are recognized by the Italian Ministry of Health for making research activities in the field of genetic diseases, innovative therapies, and regenerative medicine. We are quite a big hospital. In fact, we have each year an average of more than 50,000 inpatients, so patients that have their hospital beds at our premises. We are also very active in the field of scientific research and innovation. We took part in initiatives linked to Framework Program 7, ERC, and we are involved in 5 projects financed by the European 2020 Research Framework. Next slide, please. Okay, this slide represents the process in which my unit, which is named Innovation and Research Unit in our hospital, works. First of all, we have a multidisciplinary approach to solve problems that are typically problems of the patients or of the healthcare professionals as a whole. First of all, we have a specific commitment to raise user needs. And we make these usually through co-creation sessions that are developed in our premises with methodologies that range from agile development to more specific design thinking techniques. Usually we generate new use cases, and in this slide you will find the robotic devices, but in general we take care of ICT as a whole, so not only robotic platforms or robotic devices, but in general and in the recent past, more specifically consumer devices for monitoring quality of life of people. So we generate new use cases, and we also take care of setting up clinical trials, and so experimental sessions in our premises that usually are hospital wards or a long-term care stay that we own, or even at home. Usually, the end point is the generation of evidence, and we take care of generating evidence about the impact of these technological solutions on three main dimensions, which are the clinical one, the social one, and also the ethical one. Next slide, please. Thank you. So I'm here to tell you that essentially we have expertise in the clinical field and in the technological field in these subjects: assistive robotics, artificial intelligence, e-health, Internet of Things, big data, ambient assisted living, and cybersecurity. We can offer something. We can offer essentially our ability to design clinical protocols that involve directly patient cohorts that meet specific criteria. We have also a role. We can play a role in defining ethical aspects, the aspect of data protection. In exploitation activities, we have also an involvement in the building business cases and so on, and also in communication. At the bottom of this slide, you can find the logos of the 5 main research initiatives in which we are involved. Let me cite the 2 large-scale pilot projects, Pharaon and Gatekeeper, and another project, BD for Quality of Life, which are the projects in which we are currently involved. We also took care of being the clinical partner for the ACRA and Mario project. Next slide, please. You can find in the next slide my references. So please contact me in case you need a clinical center. We will be very open to try to establish use cases and to join your efforts in building something that can be useful for the patients and for healthcare systems. Thank you.
Thank you very much, Francisco, for the really nice presentation. We move forward with our agenda. The next presentation will be on a SME based in Italy. Sia, please feel free to take over.
Hello, thank you. And thank you for inviting me here. I would like to share my screen if possible.
Yes,
please. I'll try to click on share. Okay. Are you seeing my presentation?
Still not, probably loading. Yes, now.
Okay, now you are. Okay, so I would like to tell you something about COMTECH. Before, we design and produce textile-based solutions for monitoring vital parameters, body position and movement. COMTECH comes from Comfortable Technology. We started as a startup winning company with a project aimed at monitoring premature babies in hospitals. And from newborns to adults and elderly people, now our textile-based solutions have a wide range of applications. We can count on a multidisciplinary team, which is a quite peculiar team, being us a textile company, since we have bioengineering working together with textile technicians, designers, and also with a physiotherapist who is helping us in developing the part of our solution dedicated to movement, as we will see in the next slides. Here you can see the components of our systems: electronic unit, textile unit, and DAP. Here you can see 2 electronic units. The first one, the bigger one, is for detecting heart rate, and the second one just for detecting breathing rate. They are associated to these textile units. As you can see here, they are simply positioned through some snaps to the textile units. We have 2 tops in a male and female version, and the t-shirt, which allows for detecting thoracic and abdominal breathing. So it is mainly used for monitoring sleeping disorders. And here you can see the app. The electronic unit directly communicates with the app via Bluetooth. And on the app, you can visualize all real-time data and also reports that can be daily reports or reports referring to specific monitoring periods. These are our textile sensors. They are completely embedded in the garment. They are very soft and so comfortable, hypoallergenic. And here you can see all the advantages of a textile solution, but in the end, I would say that the most important thing is that it is a completely non-invasive way of monitoring, and it is also cost-effective since the textile unit can be washed using a simple washing machine at 30 degrees. Here you can see all our solutions, so electronics matched to textile units and apps, and as you can see, all our devices are Class 2B medically certified. So here are more specifically the parameters that we can detect: heart rate and real-time ECG tracing, respiratory rate and respiratory trace, body position, activity level and movement, and through algorithm we can measure stress index, heart rate variability, step frequency and timing. Gait analysis and balance are fundamental, especially when you talk about elderly people, because it allows us to assess the risk of fall, which can have a huge impact on the person and on the healthcare system. And at last, we have here temperature and oxygen saturation that have been integrated to the app during COVID pandemic, when they were key parameters to be detected. Here are all our textile units. The most simple one is a textile belt, which is used with newborns and with those elderly people that reject any other kind of garments. Here are some technical specifications. I would skip this slide. These are our app, the medical app and the rehabilitation app, which also allows for exercises with biofeedback. It is very useful to physiotherapists because it integrates vital parameters with parameters related to movement, so that a physiotherapist can fit, for example, the training session according to the real clinical situation of the person in the real moment, or also in relation to the previous night. If he hasn't slept well, for example, the training session can be fitted to the specific condition of the day. And here are the reports that are generated by the app for a specific monitoring period to be set by the clinician or by the physiotherapist. We have developed a software which is a kind of concentrator, so that of all data of all monitored people can be seen on one single screen instead of the mobile app, so the desktop of the smartphone. Of course, when we work with a telemedicine platform, all this data can be sent and directly be seen on the dashboard of the telemedicine platform, talking about, for example, elderly people at home. I will skip these. These are the benefits of using our systems connected to end users and the other players of this ecosystem. I would like to briefly present you a service that we are now promoting towards elderly homes. This is a service room that allows for monitoring the vital parameters both day and night in absolute comfort and freedom, and to monitor the quality of sleep through the assessment of heart variability, basal pulse, and fatigue index. This also allows for monitoring movements in the room. This is quite important for the operators of an elderly home, because they can see, for example, if some people who is supposed to be laying in bed is walking around or simply standing. And also position can be detected, because, you know, it is very important for elderly person not to keep the same position in bed for a long time. This is the kit we are providing for this kind of service. We also have a mobility service, which is more or less the same, but just integrates a SIM card so that people can be monitored out of the room and outside. And in the end, we have this rehabilitation service, which is based on the app, on the rehabilitation app, integrated to the other one. And it is interesting because it allows operators who can also be not physiotherapists to assess gait quality and stability just using some free validated tests available in the app. So I think this is all. Thank you again for inviting us, and I'm here for any questions.
Thank you, Alicia. Really nice, interesting presentation. Just one question. You're producing these sensors. Are you working together with clothing companies that also take part, so to say, of the clothing and producing these, or how do you manage it?
No, because we are a textile company. It is a second generation company, so it comes from textile. So we have an internal sensorization of garments, but we have providers in case of a huge scaling up of our production. So we are ready to face an extended market.
All right, thank you very much. I'll share now back my presentation. All right, so our next presenter is Mr. Bas Barcott from Chemistry Team Experience and Service Design. Bas, feel free to take over.
Yes, thank you very much. Can I share my screen?
Of course.
Yeah, then I will do that. Let me see this one. Just a moment there. Is it clear there, or is it just one? Let me just.
We seem to, now it's working. Perfect.
Yeah. Okay. So thank you very much for inviting us to this very nice presentation on different platforms. We've heard a lot about technology today. So talking about chemistry, we think it's all about the people and making people the center of our work, but also making people the center of every solution. So if you take a closer look at the image in the left bottom left, there you'll see actually that's what we do. So we take a look at the product or the spatial environment, which kind of influences the behavior of people. Of course, there's a lot about technology solutions, digital technology solutions, which will influence how people react and how they are supposed to be acting. And of course, and that's for all these participants today, very clear, there are a lot of policies and processes, at least in the medical field, that is. So how do we do that? What we're always trying to say, what we're always trying to start with, is how can we humanize technology? We start with the patient or the client always. How can we make something which is easy enough to use so it is delightful? But we should not forget the family members, the next of kin. That's a very important supportive role. We have to design them into the same system. They have to be able to play a meaningful role supporting their loved ones. And of course, in the whole medical area and the whole healthcare area, in the whole care area, assisted living area, there's always staff involved, either the care staff directly or the home care staff. So how can we create a culture of co-creation so that the staff feels engaged, but also wants to exchange their knowledge, because they know a lot about what they are doing, but sometimes there is quite some distance between, let's say, the theoretical knowledge and the end user. So how do we do that? Let me
We
switch
can
to
do this
yeah,
through
that
a
one.
series of task forces.
So how we create humanized technology? We do that by discovery. We try to understand the customer, try to learn from the customer, from the client, from the patient, by user research and by design thinking methods. So we are uncovering actually what are the needs, and what you will see at the right top corner. So we do a lot of researches, we do a lot of interviews with staff, with patients, with the and the actual persons who are intended to use the what is it? It could be anything, could be an app, could be a medical product, could be something completely different. So, and from that, we're trying to create the real nice experience. So we're bringing the ideas to life. And what you will see a co-creation together with the staff, together with the patients, and trying to find out, okay, where is the catch? Where it goes wrong? Why don't certain people don't like to use certain, for instance, certain apps? And it only helps if you just prototype and test and prototype and test and do that one over and over again. So the whole fail fast idea is what we think is vital for the work we are doing. And then by doing that, we're trying to transform the organization by engaging the staff and helping teams to actually to not only find new capabilities, but also to use them in the new future projects. So there's a very short overview of how we are doing things. Of course, you're more than welcome to take a look at our websites, which you see is listed here. You can reach out to me. We're either located in Singapore for the Asian market or Amsterdam for the European market. My email address is right there. Of course, I'm easy to find on LinkedIn, and I'm happy to answer all your questions right now or after this meeting. So once again, thank you very much.
Thank you, Bas. Thank you very much for a really interesting presentation. I'm going back to slides. Sorry. All right, so the next presentation will be carried by Ms. Ioni Sakaki from Project Ipsilon. Ioni, please feel free to start presenting.
And also, thank you so much. May I share my screen instead?
Of course.
Yes, thank you.
Welcome.
Here. Do you see it?
Yes.
Yeah. Okay. So thank you so much for this opportunity. My name is Yayoi Sakaki, a director of Project Ipsilon.
Sorry for interrupting you. Can you please just share it in presenting mode just to enlarge the slide?
Sorry, say that again.
Can you please do it in the presenting mode down?
Sure.
Yeah, thank you.
Sure. Does that work? Yeah. Does that work?
Yes, working. Perfect.
Okay. Great. Thank you so much. So again, my name is Yayoi Sakaki. I'm the director of Project Ipsilon. Oops, sorry. Yeah. Oh, gosh. Here we go. So dementia needs routine screening and monitoring, especially among high-risk groups with comorbidities such as cardiovascular disease as well as diabetes, to detect at precursor stages while it is still treatable to delay the onset. But such solutions are very limited or almost non-existent. So we have Ipsilon system. Our app is gamified with music playing to generate response data with specific cognitive tasks for brain function analysis. And let me play the, can I play that? Yeah, I actually have the demo, so I can actually show it to you slightly later then, because it's supposed to be played from the slide, but I guess in the presentation mode, I can't do that. So I'll show it to you at the end of the presentation. Sorry about that. So it is easy to use among elderly, routinely usable as self-care tool at home, and it takes only 5 minutes. And it covers major cognitive assessment domains relevant for dementia, and it is sensitive for prodromal or precursor stages of dementia detection, and it can relate to the clinicians for the noticed risks of potential dementia development and or cognitive decline, and arrange the care options in fast manner. And also, we are totally evidence-based, therefore, and we are in a few pilot and also cohort studies for mild cognitive impairment, which is the precursor stage of the dementia, and Parkinson's. And we are B2B business model. We're in the M-Health market, and we work with clinical institutions and regional healthcare systems as of now. And we license per year per patient, and we are actually expecting revenue from next month as a part of the cohort study with Research Institute in Norway. And as you can see, we are in multiple studies, and we should be able to file for the CE mark toward the end of this year, and we plan to file for FDA next year. And we are a team of 4, passionate about social impact on dementia through music. And we have excellent consultants on clinical researches as well as an extended team. And thank you so much. We are in search of partners for pilot either platform